Question 1. According to the NMC Code, what is the primary standard that underpins all nursing and midwifery practice? A. To adhere strictly to hospital policies at all times. B. To ensure the care of people is the first concern, treating them as individuals and respecting their dignity. C. To prioritize the efficiency of services and effective use of resources. D. To always follow the instructions of the doctor without question. Answer: B. To ensure the care of people is the first concern, treating them as individuals and respecting their dignity. This question tests your understanding of the foundational principle of the NMC Code. The keyword primary standard indicates the most important guideline for all nurses and midwives. The code explicitly states that making the care of people your first concern, respecting their individuality and dignity, is the absolute cornerstone of professional practice. For instance, when planning care, a nurse should always consider the patient's personal preferences and cultural background before anything else. Always remember that putting the patient at the heart of everything you do is your most fundamental duty. Question 2. A patient with a new prescription for an opioid analgesic is experiencing severe constipation. What is the most appropriate initial nursing intervention? A. Advise the patient to stop taking the opioid medication immediately. B. Administer an enema without a doctor's order. C. Encourage increased fluid intake, dietary fiber, and assess for a prescribed laxative or need for a new prescription. D. Inform the doctor and wait for them to address the issue on the next round. Answer: C. Encourage increased fluid intake, dietary fiber, and assess for a prescribed laxative or need for a new prescription. This question assesses your knowledge of common medication side effects and proactive nursing interventions. The keywords opioid analgesic and severe constipation highlight a known and predictable side effect that requires prompt management. The most appropriate initial action is to implement non-pharmacological interventions, check for existing orders for laxatives, and then communicate with the prescriber if a new prescription is needed. For example, offering the patient prune juice and ensuring they have easy access to fluids can help alleviate initial symptoms while you check the medication chart. Always remember to anticipate and manage common side effects of medications through both nursing actions and collaboration with the medical team. Question 3. What is the main purpose of maintaining accurate and contemporaneous patient records? A. To protect the nurse from legal action in case of error. B. To facilitate effective communication, ensure continuity of care, and provide a legal record. C. To impress auditors during hospital inspections. D. To justify the nurse's workload to management. Answer: B. To facilitate effective communication, ensure continuity of care, and provide a legal record. This question evaluates your understanding of the importance of diligent record-keeping in nursing. The phrase main purpose directs you to the core reasons why documentation is crucial. Accurate and contemporaneous, meaning at the time the event happened, records are essential for all healthcare professionals involved to have up-to-date information, which prevents gaps or duplication in care and serves as a vital legal document. For instance, documenting a patient's response to a pain medication ensures the next nurse knows whether to offer it again and how effective it was. Always remember that good record-keeping is a cornerstone of safe, continuous, and accountable patient care. Question 4. A nurse witnesses a colleague frequently bypassing the hand hygiene station between patient contacts, stating they are too busy. What is the nurse's immediate responsibility? A. Ignore it, as long as no patient has developed an infection yet. B. Offer to help the colleague with their workload. C. Remind the colleague about the importance of hand hygiene and, if the behavior persists, escalate concerns through appropriate channels. D. Report the colleague directly to the Nursing and Midwifery Council, NMC, immediately. Answer C. Remind the colleague about the importance of hand hygiene and, if the behavior persists, escalate concerns through appropriate channels. This question addresses a nurse's professional responsibility regarding patient safety and challenging unsafe practice. The keywords frequently bypassing the hand hygiene station and too busy highlight a clear breach of infection control protocol. The most appropriate immediate action is to address the issue directly and professionally with the colleague, explaining the risks. If the unsafe practice continues, the nurse has a duty to escalate their concerns through the organizational hierarchy to protect patients from potential harm. For example, you might gently say, "Just a quick reminder about hand washing between patients, it's so important for infection control." Always remember your duty to protect patients by ensuring adherence to fundamental safety practices, and to escalate if necessary. Question 5. A patient with a learning disability requires a venipuncture procedure. The patient appears anxious and withdrawn, refusing to extend their arm. How should the nurse best approach obtaining consent and performing the procedure? A. Inform the patient that the procedure is necessary and proceed quickly to minimize distress. B. Obtain consent from the patient's family or legal guardian. C. Use simple language, visual aids, and take time to explain the procedure, assessing capacity and seeking to gain their cooperation. D. Postpone the procedure indefinitely until the patient is calm. Answer C. Use simple language, visual aids, and take time to explain the procedure, assessing capacity and seeking to gain their cooperation. This question tests your understanding of consent and communication with vulnerable patients, specifically those with a learning disability. The keywords learning disability, anxious and withdrawn, and refusing to extend their arm indicate the need for a tailored, patient-centered approach. The most appropriate action is to ensure genuine consent by adapting communication methods, using simple, clear language and visual aids, and patiently trying to gain the patient's understanding and cooperation, assessing their capacity throughout. For example, showing a picture of the procedure and explaining it step by step can make it less frightening. Always remember to empower all patients to participate in their care decisions, adapting your approach to their individual needs. Question 6. What is the fundamental ethical principle that obliges nurses to act in the best interests of their patients? A. Autonomy. B. Justice. C. Beneficence. D. Non-maleficence. Answer C. Beneficence. This question assesses your knowledge of core ethical principles in nursing. The phrase "act in the best interests of their patients" is the direct definition of beneficence. Beneficence is the ethical principle that guides healthcare professionals to do good and to actively promote the well-being of their patients. For example, encouraging a patient to engage in physiotherapy to regain strength after surgery, even when it's difficult, is an act of beneficence. Always remember that beneficence means actively working to help and benefit your patients. Question 7. A nurse is conducting a medication round and identifies that a prescribed medication for a patient has expired. What is the nurse's correct action? A. Administer the medication, as it is only slightly past its expiry date. B. Dispose of the expired medication in the nearest waste bin. C. Withhold the medication, remove it from circulation, and report the issue according to local policy for safe disposal and reordering. D. Ask another nurse if they think it is still safe to use. Answer C. Withhold the medication, remove it from circulation, and report the issue according to local policy for safe disposal and reordering. This question tests your adherence to safe medication management and accountability. The keyword expired indicates that the medication is no longer considered safe or effective for administration. The correct action is to immediately withhold the expired medication to prevent patient harm, follow established procedures for its safe disposal, and ensure a new, unexpired supply is ordered. For example, an expired antibiotic would not be administered because its potency may be reduced, making it ineffective. Always remember that administering expired medication is a serious safety breach, and proper management is crucial. Question 8. A nurse is preparing a discharge summary for a patient. Which document facilitates the transfer of care and ensures continuity between different healthcare settings? A. The patient's initial admission assessment form. B. A comprehensive and clear discharge summary detailing medications, follow-up, and ongoing care needs. C. The patient's daily fluid balance chart. D. The hospital's general patient information leaflet. Answer: B. A comprehensive and clear discharge summary detailing medications, follow-up, and ongoing care needs. This question focuses on the importance of effective communication during transitions of care. The keywords transfer of care and continuity between different healthcare settings highlight the need for a document that provides all essential information. A well-prepared discharge summary is crucial because it ensures that all relevant information about the patient's hospital stay, medications, follow-up appointments, and any ongoing care requirements is clearly communicated to subsequent caregivers. For instance, without a clear list of new medications and their doses, a community nurse might not continue the correct treatment. Always remember that a thorough discharge summary is vital for a patient's safe and smooth transition home or to another care facility. Question 9. What is the primary purpose of continuous professional development, CPD, for registered nurses? A. To help nurses achieve promotions and salary increases. B. To ensure nurses maintain and enhance their knowledge and skills throughout their career, remaining fit to practice. C. To simply collect hours for NMC revalidation. D. To network with other healthcare professionals. Answer: B. To ensure nurses maintain and enhance their knowledge and skills throughout their career, remaining fit to practice. This question assesses your understanding of CPD's role in professional accountability. The phrase primary purpose indicates the core reason for engaging in CPD. CPD is crucial because it ensures nurses constantly update their knowledge, skills, and competence, thereby remaining fit to practice and providing safe, effective, and evidence-based care throughout their professional lives. For example, attending a workshop on new wound care techniques helps a nurse provide the most current and effective treatment. Always remember that CPD is about continuously growing and developing to provide the best possible care for your patients. Question 10. A patient, who is scheduled for surgery, has an allergy to latex clearly documented in their medical notes. During the consent process, the surgeon mentions using latex gloves. What is the nurse's most appropriate action? A. Assume the surgeon is aware and continue with the consent process. B. Discreetly interrupt the surgeon to clarify the latex allergy, ensuring patient safety. C. Document the discrepancy and report it to the ward manager after the consent is signed. D. Advise the patient to remind the surgeon themselves. Answer: B. Discreetly interrupt the surgeon to clarify the latex allergy, ensuring patient safety. This question tests your ability to advocate for patient safety and challenge potentially harmful situations. The keywords allergy to latex clearly documented and surgeon mentions using latex gloves represent a direct threat to patient safety. The nurse's most appropriate immediate action is to intervene respectfully but firmly to prevent potential harm by ensuring the surgical team is aware of and plans for the allergy. For example, you might politely interject, "Excuse me, doctor, just to confirm, this patient has a documented latex allergy." Always remember that patient safety is your ultimate priority, and you have a duty to speak up when you identify a potential risk. Question 11. What is the role of an advance statement or advance decision to refuse treatment in UK healthcare? A. It is a legally binding document allowing a patient to refuse specific medical treatments in the future if they lose capacity. B. It is a recommendation from the family about future care. C. It is a document that gives consent for all future medical treatments. D. It is a non-binding expression of wishes that can be overridden by medical staff. Answer: A. It is a legally binding document allowing a patient to refuse specific medical treatments in the future if they lose capacity. This question assesses your knowledge of legal frameworks related to patient autonomy and future care. The keywords advance statement and advance decision to refuse treatment refer to a patient's legal right to predetermine their healthcare choices. This is a legally binding document for competent adults, enabling them to refuse specific medical treatments in anticipation of a time when they might lack the capacity to make or communicate those decisions. For example, a patient with a progressive neurological condition might make an advanced decision to refuse artificial ventilation if they reach a certain stage of their illness. Always remember that respecting an advance statement upholds a patient's autonomy, even when they can no longer speak for themselves. Question 12. A nurse is preparing to administer medication via a nasogastric tube. What is the most crucial step before administering the medication? A. Crush all tablets together to make administration easier. B. Check the patient's diet chart to ensure they are allowed oral intake. C. Verify the correct placement of the nasogastric tube. D. Warm the medication to body temperature. Answer: C. Verify the correct placement of the nasogastric tube. This question tests a critical safety procedure for medication administration via a tube. The keyword most crucial step highlights the highest priority. Verifying the correct placement of the nasogastric tube is essential to prevent medication from being instilled into the lungs, which could cause aspiration pneumonia or other serious complications. For example, checking the pH of aspirated fluid and/or reviewing a recent X-ray confirmation are standard methods to ensure correct tube position. Always remember that ensuring the tube is in the correct place is paramount to patient safety before administering anything. Question 13. A patient's family expresses dissatisfaction with the care their relative is receiving and wishes to make a formal complaint. What is the nurse's most appropriate initial response? A. Defend the care being provided and dismiss their concerns. B. Advise them to wait until the patient is discharged before complaining. C. Listen empathetically, acknowledge their concerns, and explain the hospital's complaints procedure. D. Tell them that complaining will not change anything. Answer: C. Listen empathetically, acknowledge their concerns, and explain the hospital's complaints procedure. This question tests your communication skills and understanding of patient and family rights within healthcare. The keywords dissatisfaction and formal complaint indicate a need for a professional and supportive response. The most appropriate action is to listen actively and empathetically to their concerns, validate their feelings, and clearly explain the process for making a formal complaint, which aligns with the NMC Code standard of being open and acting with integrity. For example, providing them with a leaflet about the Patient Advice and Liaison Service, PALS, would be a practical step. Always remember that addressing complaints respectfully is part of good customer service and maintaining public trust. Question 14. What is the primary reason for a nurse to undertake a risk assessment for a patient, e.g., for falls or pressure ulcers? A. To assign blame if an adverse event occurs. B. To fulfill an administrative requirement for documentation. C. To proactively identify potential hazards and implement preventative measures to ensure patient safety. D. To determine staffing levels required for the patient. Answer: C. to proactively identify potential hazards and implement preventative measures to ensure patient safety. This question explores the fundamental purpose of risk assessment in patient care. The phrase primary reason emphasizes the core objective. Risk assessments, such as for falls or pressure ulcers, are essential because they allow nurses to proactively identify specific risks unique to each patient and implement tailored preventative strategies, thereby enhancing patient safety and preventing harm. For example, if a patient is identified as a high fall risk, a care plan might include bed alarms and regular toileting. Always remember that risk assessment is a proactive tool for protecting your patients. Question 15. A patient with newly diagnosed diabetes is struggling to understand how to administer their insulin injections. What is the nurse's most appropriate teaching strategy? A. Give the patient a leaflet and tell them to read it at home. B. Administer the injection for them each time they are due. C. Provide repeated, clear, step-by-step demonstrations, allow the patient to practice under supervision, and assess their understanding. D. Tell the patient that their family will have to administer the injections for them. Answer: C. Provide repeated, clear, step-by-step demonstrations, allow the patient to practice under supervision, and assess their understanding. This question tests effective patient education strategies, particularly for a complex skill like insulin administration. The keywords newly diagnosed diabetes and struggling to understand how to administer indicate a need for comprehensive and practical teaching. The most appropriate strategy involves a multimodal approach, demonstrating the skill, allowing for supervised practice, and continuously assessing the patient's comprehension to ensure they become competent and confident in self-management. For example, the nurse would demonstrate mixing the insulin, then guide the patient's hand as they perform the steps, correcting any errors gently. Always remember that hands-on, interactive teaching with feedback is most effective for skill acquisition. Question 16. What is the significance of the duty of candour in nursing practice? A. It requires nurses to disclose all medical errors to the public. B. It mandates that nurses must be open and honest with patients when something has gone wrong with their care, including an apology and explanation. C. It is an optional guideline for nurses to follow if they choose. D. It applies only to doctors, not nurses. Answer: B. It mandates that nurses must be open and honest with patients when something has gone wrong with their care, including an apology and explanation. This question assesses your understanding of the duty of candour, a critical professional and ethical obligation. The keyword significance highlights its importance in practice. The duty of candour legally and professionally requires healthcare professionals, including nurses, to be open and honest with patients when something goes wrong with their care that causes or has the potential to cause harm, providing a truthful explanation and an apology. For example, if a patient receives the wrong medication, the nurse must immediately inform them, explain what happened, and what steps are being taken to mitigate harm. Always remember that transparency and honesty are crucial for building and maintaining trust with patients. Question 17. A nurse is providing care for a patient who frequently becomes aggressive and verbally abusive. What is the nurse's primary responsibility in managing this behavior? A. Restrain the patient immediately to ensure safety. B. Punish the patient for their aggressive behavior. C. Identify and address the underlying causes of the behavior, while ensuring the safety of the patient and staff. D. Transfer the patient to another ward. Answer: C. Identify and address the underlying causes of the behavior, while ensuring the safety of the patient and staff. This question tests your ability to manage challenging patient behavior with a therapeutic and safety-focused approach. The keywords frequently aggressive and verbally abusive indicate a need for skilled de-escalation and problem-solving. The primary responsibility is to understand why the patient is behaving this way, e.g., pain, fear, delirium, mental health crisis, and address the root cause, while always prioritizing the safety of everyone involved. For example, checking for pain, hunger, or environmental triggers can often de-escalate the situation and provide clues for the care plan. Always remember that aggressive behavior is often a sign of distress, and understanding the cause is key to effective management. Question 18. What is the nurse's role in relation to a patient's personal property and valuables in a hospital setting? A. The nurse is not responsible for patient's personal belongings. B. Advise the patient to keep all valuables at home, as the hospital cannot be held responsible. C. Ensure the patient's property is documented, kept safely, and returned, following hospital policy. D. Allow the patient to keep valuables at their bedside as they prefer. Answer: C. Ensure the patient's property is documented, kept safely, and returned, following hospital policy. This question assesses your understanding of safeguarding patient belongings, a component of respectful and ethical care. The phrase patient's personal property and valuables highlights the responsibility healthcare staff have to protect these items. Nurses have a professional and ethical duty to ensure that patients' belongings are documented, secured according to hospital policy, e.g., in a safe, and returned to them upon discharge, treating them with respect and preventing loss. For example, if a patient brings in jewelry, the nurse should offer to place it in the hospital safe and document it, rather than leaving it unsecured at the bedside. Always remember to treat a patient's belongings with the same care and respect as you would your own. Question 19. A nurse is conducting a handover to the night staff. Which communication tool is most appropriate for ensuring concise, comprehensive, and structured patient information transfer? A. An informal chat about the patients. B. Reading out the entire patient's medical history. C. SBAR, situation, background, assessment, recommendation. D. A verbal update only to the oncoming nurse. Answer: C. SBAR, situation, background, assessment, recommendation. This question tests your knowledge of effective communication tools in a clinical setting. The keywords concise, comprehensive, and structured patient information transfer point directly to the purpose of structured communication. SBAR, situation, background, assessment, recommendation, is a widely recognized communication framework that ensures all critical information is shared clearly and systematically during handovers, reducing the risk of errors and promoting patient safety. For example, when handing over a patient, you would start with their current situation, then provide relevant background, your assessment of their condition, and finally, your recommendations for their ongoing care. Always remember that structured communication tools like SBAR are vital for patient safety and effective teamwork. Question 20. A patient with severe dementia requires assistance with feeding. The patient is refusing to open their mouth and is pushing the spoon away. What is the nurse's most appropriate initial approach? A. Force feed the patient to ensure they receive adequate nutrition. B. Document the refusal and remove the food. C. Offer small, appealing portions, use a calm and encouraging approach, assess for pain or discomfort, and involve family for preferences. D. Ask another staff member to feed the patient immediately. Answer: C. Offer small, appealing portions, use a calm and encouraging approach, assess for pain or discomfort, and involve family for preferences. This question challenges nurses to provide dignified and person-centered care to patients with cognitive impairments who may have difficulty communicating their needs. The keywords severe dementia, refusing to open their mouth, and pushing the spoon away indicate potential distress or discomfort. The most appropriate initial action is a gentle, patient approach, assessing for underlying causes like pain or an uncomfortable position, and trying different strategies, including involving family who know the patient's preferences. For example, offering a favorite food in a quiet, unhurried environment can often be more successful than a rushed attempt. Always remember to approach patients with dementia with patience and respect, seeking to understand their nonverbal cues. Question 21. What is the nurse's role in managing a blood transfusion for a patient? A. To solely obtain consent for the transfusion. B. To collect the blood, administer it without further checks, and monitor for side effects. C. To verify the patient's identity and blood product details with another registered professional, monitor for adverse reactions, and document thoroughly. D. To only document the transfusion after it has been completed. Answer: C. To verify the patient's identity and blood product details with another registered professional, monitor for adverse reactions, and document thoroughly. This question tests your knowledge of the critical safety steps involved in blood transfusion. The keywords blood transfusion signify a high-risk procedure requiring meticulous attention to detail. The nurse's role involves a stringent verification process with another registered professional, ensuring the correct patient receives the correct blood product, followed by careful monitoring for any adverse reactions and comprehensive documentation. For example, before connecting the blood, two nurses must check the patient's identity against the blood bag label at the bedside. Always remember that strict adherence to protocols during blood transfusions is paramount to patient safety. Question 22. A nurse identifies a wound that is showing signs of infection, redness, warmth, purulent exudate, on a patient. What is the nurse's immediate priority? A. Apply a simple dressing and continue to monitor. B. Immediately contact the patient's family. C. Swab the wound for microbiology, document findings, escalate to the medical team for review, and initiate appropriate wound care. D. Administer a broad-spectrum antibiotic from the stock cupboard. Answer: C. Swab the wound for microbiology, document findings, escalate to the medical team for review, and initiate appropriate wound care. This question assesses your ability to recognize and manage a potential infection effectively. The keywords signs of infection, redness, warmth, purulent exudate, on a wound indicate a clear clinical problem that requires prompt action. The immediate priority is to collect a wound swab for accurate microbiological diagnosis, meticulously document the assessment, escalate the findings to the medical team for antibiotic consideration, and initiate appropriate local wound care to prevent further spread or deterioration. For example, cleaning the wound and applying a suitable dressing while awaiting doctor's orders is part of initial management. Always remember that timely identification and management of wound infections are crucial for patient recovery. Question 23. A patient reports feeling breathless and dizzy after receiving a new medication. Their blood pressure is significantly lower than their baseline. What is the nurse's immediate priority? A. Reassure the patient that these are common side effects. B. Document the vital signs and continue to monitor the patient for a few hours. C. Elevate the patient's legs, ensure airway patency, and escalate findings to the medical team urgently. D. Administer an additional dose of the new medication to see if symptoms improve. Answer: C. Elevate the patient's legs, ensure airway patency, and escalate findings to the medical team urgently. This question tests your ability to respond to a potentially serious adverse drug reaction or sudden deterioration. The keywords breathless and dizzy, blood pressure significantly lower than their baseline, and new medication indicate a possible acute hypotensive episode or allergic reaction. The immediate priority is to stabilize the patient, ensure their airway is clear, manage the low blood pressure, e.g., by elevating legs if no contraindications, and urgently escalate these critical findings to the medical team. For instance, if the patient becomes unresponsive, an ABCDE assessment and emergency call would be triggered. Always remember that sudden changes in vital signs, especially after new medication, require immediate assessment and urgent medical review. Question 24. A nurse is observing a new healthcare assistant, HCA, who is struggling to perform basic personal care tasks correctly, despite having received initial training. What is the nurse's most appropriate action? A. Take over all personal care tasks from the HCA to ensure they are done correctly. B. Report the HCA's incompetence to the ward manager and request their removal from the ward. C. Provide immediate, constructive feedback and re-demonstrate the correct technique, offering further supervised practice and identifying if additional training is needed. D. Tell the HCA to refer to their training manual for guidance. Answer: C. Provide immediate, constructive feedback and re-demonstrate the correct technique, offering further supervised practice and identifying if additional training is needed. This question addresses professional development and responsible supervision in a team setting. The keywords struggling to perform basic personal care tasks correctly and despite having received initial training indicate a learning need rather than intentional poor practice. The most appropriate action is to actively support the HCA through direct, constructive feedback, re-demonstration, supervised practice, and identifying any gaps in their understanding or further training requirements. For example, a nurse might say, "Let me show you the correct way to position a patient for hygiene to protect their skin, and then you can try it with me watching." Always remember your role in supporting the development of your colleagues to ensure safe patient care. Question 25. An elderly patient with a history of falls is regularly found wandering out of their room unsupervised at night. What is the most appropriate long-term nursing intervention to reduce this risk while respecting the patient's dignity? A. Administer night sedation to ensure the patient sleeps through the night. B. Use bed rails or soft restraints to keep the patient in bed. C. Implement a personalized care plan that includes regular toileting, a safe environment, and addressing underlying causes for wandering, such as pain or disorientation. D. Assign a dedicated 1:1 constant watch for the patient every night. Answer: C. Implement a personalized care plan that includes regular toileting, a safe environment, and addressing underlying causes for wandering, such as pain or disorientation. This question tests your ability to develop a comprehensive, person-centered care plan for fall prevention, particularly for an elderly patient. The keywords elderly patient, history of falls, and regularly found wandering indicate a persistent risk that requires a multifaceted approach beyond simple restraint. The most appropriate long-term intervention is a personalized care plan that addresses potential triggers for wandering, e.g., pain, needing to use the toilet, ensures a safe environment, and considers non-restrictive interventions tailored to the individual. For example, ensuring a clear path to the bathroom and checking for any unmet needs like hunger or thirst can reduce wandering. Always remember that patient safety and dignity are best balanced through individualized, least restrictive care planning.